Welcome back to Defense News Weekly. I'm Leo Shane, Capitol Hill Bureau Chief for Military Times, coming to you today from our studio in Washington, D.C. Today with us, we have Jon Retzer, Deputy National Legislative Director for Health at Disabled American Veterans. John, I asked you to come here to talk about the independent budget. This is something that Disabled American Veterans, Paralyzed Veterans of America, and Veterans of Foreign Wars put together to sort of give a sense of what the needs are at VA. And the report this year that you guys have put together says that there are still significant needs. You're talking about a 15 to 20% increase in VA spending or funding that's needed. VA has seen quite a bit of increase over recent years, especially as other government agencies have pulled back. Why do you think that VA needs that much money? What are you guys seeing that maybe the public isn't?
Well, first, thank you for having DAV and for us to have an opportunity to speak with you on this. This is a very important issue that we have tackled for nearly 40 years with the three organizations. And what we try to do with this budget recommendation is to, speak on behalf of what we see from our members, our users in the veterans healthcare and the benefits side. So I think one of the things that we see with regards to the needs of this report is that to provide the services and in benefits and in healthcare, we need to be able to realistically look at these numbers of all the needs in the different service department lines. And so when you look at, for example, the healthcare, you're looking at a population of right now, veteran population, about 18 million veterans, but over 9.1 million veterans are enrolled in the VA healthcare system. So it's the largest integrated healthcare system in our nation. And to be able to provide services where the veterans are, and we have to understand that they're in every state. They are in metropolitans, they're in remote rural areas, and we have veterans that have very specialized care. With modern medicine, what medicine has been able to do to save lives has also left our veterans with very serious injuries and illnesses to try to live their life with some type of quality and dignity and able to live a fulfilling life. So what we've done here is looking at a very comprehensive way to identify very tailored individual care needs for veterans at whatever they're dealing with and wherever they're at. So I think when you look at it from a standpoint of the priorities that you see, for example, suicide prevention, mental health issues, that's a huge issue because we know that in the most recent report that the 2022 year shows that we had an increase in veteran suicide, unfortunately. And when we look at the time period in which they were recording the data with regards to veteran suicide, we have seen from 2000 to now that has been a steady increase going throughout that period from 2000 to where we are now. So we have to be able to address these issues. But when you address the issue of mental health and suicide prevention, it's complicated. There's so many components built into it. So you have the infrastructure. And within the physical infrastructure, you have major, minor construction issues, and then you have technology issues. Right now, the Congress and VA are tackling the electronic health record system to being able to not only have ability to exchange documents from one VISN within the VA, and that's the VA's regional locations, to be able to speak to the department levels at the VA medical centers, and then to the CBOCs, but it's also to partner with our community care. But then there's another component of that too that we need to do with DoD. We need to be able to work with the Department of Defense to be able to have that interoperability within DoD and VA to speak to each other about what happens with service members, the records following them through the benefit side, and then also the benefit side going to the healthcare side. And so that there's that continuity of understanding where the veteran started their injuries and illnesses, what's happening with them to coordinate their care, and then obviously, we have our partnership with community care. That takes a very large infrastructure. So when we look at it, we've got the major, minor physical buildings, we've got IT needs, but then to make all that work, staffing. There is an ongoing issue of staffing, and people may ask, well, the veteran population is showing a reduction as we go through the years. But the fact is, while we see these reductions in the population of veterans, it's so important to understand the request for the need for direct VA healthcare is increasing. So another example of the infrastructure and even the ability to work within the community is, for example, our long-term care. Our 9.1 million veterans that are enrolled, but you'll see that there is an increase in veteran population that are over age 65. So as that is increasing, we call it the silver tsunami. Those veterans that are 65 and older are so large in population that the infrastructure is not ready for that. So we have to have very robust abilities to not only provide VA direct long-term care, but also within the community by partnering with state veterans homes, for example, and community living centers out there.
I think it's really interesting because a lot of folks see the end of the wars in Iraq and Afghanistan. They think, okay, so now those costs are finished. Now we're done with that. Whereas VA, that's really the starting point now. You're looking at going into the future, as you said, the silver tsunami, as some of these groups age. It's really the costs coming to bear from the wounds and from the injuries there. So I guess it shouldn't be a surprise that more money's needed, but is it at a sustainable pace at this point? Is what you guys are looking at in this and with your recommendations talking about another big increase when there's big increases, have been big increases? Is that just a realistic plan forward?
And I think, when we look at our report, what we're doing is we're looking at the history of VA, the needs of our veteran population, and as we look at it, we just had, the Honoring Our Pact Act. Mm-hmm. That is huge. When you look at that massive piece of legislation, it had a lot of components in there, which actually brings in new users. So Leo, your comment with regards to it starts at VA, it actually starts before that too. What you'll see in our independent report is that we actually have references talking about the Transition Assistance Program. For our military personnel, our service members out there that are dealing with that transition component, it starts with that benefit side, but there's also a healthcare component. So you'll even see where we talk about, increasing the FTE. So for our social workers, we want to ensure that there's a plus up of 3,000 employees brought into a full-time level within the VA. And people may ask, why is that? Well, the reason why we recommended that is a lot of people did not understand our social workers within the VA system are actually wearing two hats. They have a responsibility to not only the Department of Veterans Affairs and the veteran community, but they also have a responsibility to the Department of Defense, helping our service members navigate, for example, deployment issues, counseling for the family and the service member on that. So when they have those two types of very demanding responsibilities, we want to ensure that we start it right at where it begins. And that's with DoD. That's with the Department of Defense, their service, and their injuries and illnesses that actually occur directly from or aggravated by their service. So the PACT Act, like we were talking about, that was all about presumptive issues, being exposed to toxic exposures, and unfortunately leading to very serious illnesses for them, which we have to address those matters with Department of Defense.
So let's talk about the PACT Act, because that passed just a few years ago now. That was a massive expansion of benefits for toxic exposure injuries, really a game-changing piece of legislation. Well, one that has brought, I believe, somewhere around 200,000 new patients into the VA system in the last few years. I know you guys in the independent budget are projecting at least 50,000 more next year. This is going to sound insensitive here, but is that a bad thing? Is that increased usage of bringing those people in? That's increased cost, that's increased stuff, but like that is the goal here, is to bring those folks in and to increase participation, correct?
Yes, I think one of the most important things to understand is these are benefits that our service members earn, and they continue to be able to utilize those benefits that they've earned through their veterans experience, and also to include their caregivers, their family members in that process. When we look at, the benefits that they have earned and what happens with that transition, it's so important that we continue to provide those resources. When you look at it, it saves monies for the taxpayers when you maintain a robust system. There has been such a long and hard investments that have been made within the Department of Veterans Affairs to keep the promise to our veterans for their service, to honor their service, and to say, we'll take care of you. And I think that is where we continue to work with Congress and the administrations to make sure that they don't forget our promise. It's so important, because when you look at what medicine does, it saves lives. But unfortunately, they're living with very catastrophic issues that we got to make sure that we are able to bring a quality of life for them and their families.
You said you'd make sure they don't forget that promise. I mean, that shouldn't be that hard of a sell, but I know that in a time of constrained budgets and a time of cost cutting, which we're in now, that can be somewhat of a difficult pitch. When you've taken the independent budget to Congress in the past, I know they haven't matched it dollar for dollar, but is this at least a receptive message to them, something where they can understand where you're coming from and understand the needs, and at least start a conversation about what those are?
Yes, just a couple of weeks ago when we launched the independent budget, we were very fortunate to have the opportunity to be on the Hill to present the report, and it was good to see that we had very bipartisan approach to come and sit down with us and even ask very thoughtful questions with regards to why we're asking for all of this. And we were able to highlight, like I did at the beginning of our interview here, is talk about mental health, suicide prevention, long-term care, the infrastructure, even talking about the tough discussions we've had with where do we go and where are we with electronic, modernization of the health record system, being that there's been a lot of taxpayers' money with regards to that. So we want to make sure that we continue to be responsible with taxpayers' money, but we also want to keep that promise to our service-disabled veterans.